let's talk about the MCCPDC, the Mark Cuban
MCCPDT.
cost plus drug company.
Mm-hmm.
It seems to me like every wealthy billionaire now just playing a game, copying Reddit. We're going to talk about this, I think, in a week or two, but you have, everybody's jumping in on one particular app style right now. And Mark Cuban is starting a generic drug startup with his name on it.
Well, okay, so if you read the story of this, it actually, I don't know whether it appeared on Shark Tank or the doctor that
It
created
didn't.
this, something around Shark Tank like. But anyway, this doctor brought this company thought process to Mark Cuban and some others. Mark Cuban decided not only to invest in it, and now that he's been investing in it and investigating the idea for over a year, Mark Cuban thought, well, the only way to get people to buy into this is for him to put his name on it. To basically, hey, I'm doing this as a marketing thing, right? And the idea is simple.
It's credibility.
Right.
And the brand that is around Mark Cuban, I think that I think it's just him being himself, authentic. And I think it comes from both Twitter and having been on Shark Tank, and because Shark Tank is the number one channel watched by number one TV show watched by families together.
Really? I didn't know that.
It is
I've only seen a couple of episodes of Shark Tank in its entire existence. I find it very formulaic and over, and it's over dramatized and
of course.
Whatever, and good for them. Hey, it makes them money. It gets these products in front of people that might have not otherwise had. Good for them, but not a big fan. Anyway, the point is, what's the idea here? The idea is simple.
Because it was originally called OSHA's Affordable Pharmaceuticals, created by Alex Oshamansky.
Yes.
And he cold emailed Cuban. Cold
I knew
emails
it was
work, people.
Yeah.
Don't. There's no reason not to try. You got nothing to lose. Email's free.
Because this was going nowhere under this poor doctor, right? This doctor had a great idea. It was going nowhere. He gets Mark Cuban involved, and guess what? They got their first product coming out this year. And here's the point. The whole idea is we're going to look, everybody knows the story of drug companies and costs of drugs, right? Everybody knows that there's diabetics out there that can't afford their insulin, right? And this doctor, if I remember right from the story, this doctor is one of them. Right? He's a diabetic. Now, he can afford his medicine, but insulin's gone up so much in cost that he's like, wait, the idea is if you can get enough money and you can get enough manufacturing behind you, somebody that can manufacture a bunch of these drugs that are out of patent, right? Which drug manufacturers get 10 years. Guaranteed patent. They can extend it, but really it's 10 years. So after that, the patent is open to any drug manufacturer out there. If you can get a manufacturer, somebody to create these, and they're, according to Cuban, they're going to take the cost of manufacturing plus 15%. That's it.
That's it.
So whatever it is, and this first drug that they've got coming out this year, I think it's for ringworm or something like that, which is a big deal in a lot of third world countries and stuff like that, that instead of $200, it's supposed to cost like $20.
And listen, if you're outside of if you're within the United States and you've never attempted to get drugs in other countries, it's wild what we're paying here, right?
Right.
And that is not to make a political statement or anything like that. That's just to say, you live in Texas, and when you live in Texas, you know one thing: you're paying $600 a month for your diabetes medication in Texas. And hop the border and pay $50 for the exact same box of medicine.
And look, it's that Americans have money, right? And drug companies are bound by the same capitalist rules as most people. If I can get you to pay, if I'm the only one maker of the drug that you need, I can charge whatever I want to charge for it, right? It's very capitalist in its idea.
Yeah.
But when it comes to people's health and medications they need, like insulin or like AIDS medication or cancer medications or things like this.
Or hey, asthma drugs.
Right. Oh, well, exactly.
By the way, this inhaler is illegal in this country because it doesn't meet with EPA standards.
The
So I have to
actual
buy.
inhaler itself or the medicine itself?
No, no. So the delivery of the medicine, the medicine itself
Mm-hmm.
is public domain, right?
Right.
It's not under that 10 years deal, but
Right.
the delivery of the medicine does. The EPA created a new standard, which allowed the drug companies to go create a new patent. It
Right.
started the cycle over again because I was paying next $5 without insurance. It was $5 for my extremely necessary inhaler.
Mm-hmm.
And the government said, no, we have to, whatever, the whales, the turtles. So
Right.
whatever it was. So that created a new cycle where $50 with insurance.
And that allows pharmaceutical companies and big pharma to turn around and, like you said, go from $5 to $50 for something
Right.
that the medicine itself didn't change. It's
No,
the same
the
medicine.
delivery. It's
The
the
delivery
delivery.
did, and they play those games all the time.
Sure do.
I spent my young career in pharmacy, and I saw this over and over and over again in medicines that would come out. There are actually big pharma medicines that they find at very similar times as products. They'll put one out and put another one in their back pocket for 2 years because they're similar, but one maybe work better than the other, and they put it in they shelve it like a movie. This could be helping people, and they shelve it so that they can come out with drugs in a certain timeline and things like that.
Hey, this is not to diminish the fact that you want to sell a drug in this country, you have to get it through FDA approval. That is $1 billion process.
Absolutely.
You want to
And
sell a drug in other countries, there is a pharmacist that has to dispense it. That's required by law. You know that. A doctor has to prescribe it. If you're, like I said, a Texan and you hop off over the border to ye old Mexico, there's none of those. Nobody. Okay.
well, but here's my deal. Again, you know me, and you make fun of me this, and I say this. I am a capitalist. I get it. You have the ability to have a company, and if you have a product, you are allowed to charge whatever you want for that product. Okay, with or without a conscience, it's up to you. It's not in capitalism. However, a Mark Cuban, a billionaire, has
Could come
the
in
ability in that
do-
capitalist system to come in and make the same drug that's not under patent, right? That's perfectly legal, and charge way less than you. And what does that do to you? It makes you charge way less in the long run. Because really, Mark Cuban doesn't want to go out and manufacture every drug on the market
No,
through
he
his
doesn't
system.
care.
He wants to force the hand of all of these drug manufacturers out there to compete. Because that's really what gets prices down.
And so what is interesting is, we talked about this in the last episode, and I said we would, circle back to the subject. And that is the fact that in these here United States of America, we have these things that people that I refer to as regular boys. I call them just they're regular boys, but they're billionaires. They're the
Right.
Elon Musks and the Mark Cubans, two people we talked about. They're the guys who want to go on Joe Rogan. They drink beer and I don't know. I think Mark Cuban drives a Lexus, but I'm just saying he has billions of dollars. He lives in a huge house that he bought in Dallas because he got an amazing deal on it. I think the guy took a huge loss. It was a $10 million loss. He just bought it for $12 million.
Yep.
And he is, despite the volume of capital at his disposal, he is more of a regular guy than I would say a college professor.
I met him one time. I actually worked
Really?
in the pharmacy as a young man. The
I know.
pharmacy he used in North Dallas.
Oh, okay.
Him, Mary Kay of Mary Kay Cosmetics before she passed away. Basically, the Richie part of North Dallas, right? And I met Mark Cuban, and now I say I meet. He came in to pick up a prescription. It's not like we had a long conversation or anything like that. But what little interaction I had was that exact same. Just a normal guy. You wouldn't know him.
Yeah.
If you didn't know his face, you wouldn't know him from any other guy.
I also happen to know that I work out at the same gym he does. And they say, yeah, he's on the schedule for pickup games every couple of mornings.
Good for him. He loves basketball.
Yeah,
but so he's going at this, and he's one of those guys that it seems to be he wants to take his billions of dollars and do things meaningful with them. right? He keeps talking about this over and over and doing it with drugs. Hey, you know what? This has been a wide open field. We've been talking about drug prices in America for 25
Decades.
years,
Yeah.
right? For decades. He's the first billionaire to come in and say, "Hey, let's do this. Let's throw some
Right.
money at this and see what happens."
So what's interesting is in this episode today, we've talked about two things, and two of those stories were billionaires disrupting industries by incumbent players that are not providing the best service. And I think that is an interesting dialogue to have, which is Mark Cuban has absolutely nothing to do with the pharmaceutical. He didn't make $1 billion in pharmaceuticals. He
Nope.
made $1 billion in tech. He made $1 billion out of from companies that don't even really exist anymore, right?
Right.
Because they
Yeah.
acquired his stuff. But I think it's really interesting that guy who co-founded PayPal and a guy who started broadcast.com are in these industries entirely outside of the where they started. And in the article, like, because I initially, like, there's that scene in Iron Man where the one character is like, yeah, we're from the Strategic Homeland Intervention something, and he's like, yeah, Shield.
Yeah, you should get a shorter name. And he's like, "We're working on that."
Yeah, we're working on. That's why I called it the TMCCPDC, because the Mark Cuban cost plus drug company. But the guy who created it, Oshamansky, I think I'm probably saying that wrong, but
Well, but he's still there. Apparently, from what
he
I read, Mark Cuban
he's
brought him on. It's
not only Oshamansky is still there, Mark Cuban retained him. Oshmansky's happy that they're putting Mark Cuban's name on it, right? Because they
absolutely.
understand that what it's going to do for the business, and the underlying proposition is we're going to make probably millions and eventually hundreds of millions and probably eventually billions of dollars by sticking it to the pharmaceutical business, which is, it seems to be 2021's theme, which is we're all going to get wealthy sticking it to people richer than us.
Jam it to the elites, man. Jam it to the elites. And let me say it. Look. Let me tell you. We're all sellouts to a certain extent. Okay. If Mark Cuban wanted to put his name on Idiots versus Idiots, would be Idiots versus Idiots, brought to you by Mark Cuban. Or
Yeah.
Mark Cuban brings you Idiots versus Idiots.
Whatever he
look.
wants.
I don't care. I wouldn't care if it was MaxiPad. Idiots
Yeah.
versus Idiots, brought to you by MaxiPads. Okay. I
Anybody.
don't care. The point is we're all sellouts to a certain extent, and I am glad to see that people like Mark Cuban, Elon Musk, and hopefully others along the way have this ability, start doing these kind of things, because it feels right, but at the same time they make money. So it's not just altruistic, right? It's not just, hey,
Right.
He's going in eyes wide open, hey, I'm going to make money off of this. I'm not going to make as much money as Pfizer, but I'm going to make money.
And if he wasn't able to make money, he wouldn't be able to do it.
Exactly. There's
So,
nothing wrong with
again-
making money doing good things.
Again, let the anarcho-capitalist of this show, the resident economist of Idiots,
My ass, but go ahead.
let him remind all of you. He told you you can stick it to the wealthy elites and make money at the same time, and it's a meme and it's a good time. And I'm just saying, kept telling me you couldn't do that, but look, you can. And they, in the article, which we'll have linked in the description of the show, as we do with all of our articles and sponsors, they mentioned Martin Shkreli, Pharma Bro, which the phrase "bro" in Pharma Bro is it? Yeah, it is. It's a.
But go ahead.
Slur. They're slurring him.
Yes.
And I just want to I just want on Idiots versus Idiots to have a moment of silence. Pharma Bro did nothing wrong. Martin Shkreli did nothing wrong. We are Martin Shkreli.
No.
All I can say is
Finish what you're saying very carefully.
when he gets out, I can't wait to listen to him on. Before we jump into the next story, I want to talk about our last sponsor for the show, my company, Rise Relentless. Rise Relentless sells fun mugs, coffee mugs for entrepreneurs, side hustlers, everyone that dares to dream big, short and sweet, not going to be a long thing like someone else did it. Big man gear.
So what are an example of some of these mugs, Danny?
Are you going to pop them up on the screen? Is that what you're going to do?
No, 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 no. I don't have any pictures. I just wanted to say that you pick on me all the time about my makeup of art, and I
Yeah.
gotta say that there's a couple of them on yours that are lacking.
Oh, okay. I feel the same way about your face and your entire decor in your studio.